Too. My name is Liara Tatina and I'm Customer Relations Executive for Asian Pacific and Education Lead. I will be moderating the session today. All questions will be answered at the conclusion of the presentation. Online attendees, please use the Q&A box to type your questions to the presenter. On-site attendees, please use the microphone if you'd like to ask a question. Okay. I'm now pleased to introduce Christine Haas and Frank Geier, the Federal Institute for Drugs and Medical Devices, Germany, who will be presenting the German National Release Center and eHealth activities in Germany. Christine and Frank, please proceed.
Okay. Thank you. We have the pleasure to introduce you on our journey. We have started 2 years ago with our National Release Center, and we would like to resume and take you on our way, what we've done, what has happened in the last 2 years in our center. So what we first, I give you a small introduction on our NRC activities and how we are working, what is our environment, and then I hand over to Frank for the details and the activities what we're doing in our center. So now, the NRC is in Germany is located at BfArM. BfArM is the Federal Institute for Drugs and Medical Devices. It's a federal institution in the portfolio of the German Ministry of Health. So we are an authority, and mainly the BfArM is the regulatory agency for medical products and medical devices authorization. So the responsibilities in eHealth digitalization are quite new, and they have been transferred mainly from the former DIMDI, which has also merged in 2020 in the BfArM. So now, what our activities for semantics and telematics are at BfArM, we have a wide spectrum of semantic activities. So we have the WHO classification center with all classifications. We have the SNOMED National Release Center, LAWINC, the national procedure system. We work on orphan drugs, and we have orphan diseases, and we have also the OID register. This is embedded in the telematics activities, and we work close together within BfArM. For example, for the digital apps, these are when a digital apps wants to get reimbursed in Germany. So I think that's a very special way. They are authorized by BfArM, and we look at the semantics that it's in line with the electronic health record activities. We work together with the Health Data Hub. That is the reuse of primary data for secondary use and research. Then we are connected with a new development, where I come later on. And we join also the cross-border activities for transfer of data from and to Europe to Germany. This we are in the larger BfArM. We have as the authority for authorization of medicinal products and medical devices. We have further a big expertise in these domains, so we can link with to the more medical, pharmaceutical code systems for medicinal for product substances and medical devices.
Maybe it's our range if you want to say.
Okay, so it was too much. So how we have organized our NRC? We have established an advisory board, the so-called KKG AG SNOMED, which is on the one hand side our strategic supports the strategic decisions, and they are the action plan, what we're doing and what we are developing, And under this advisory board, we just started to establish domain expert boards for specific areas. So when it's decided that we work on a specific area, for example, and at the moment it's laboratory or nursing care, we established domain expert boards with, on the one hand side, give us the domain expertise, but on the other side also are responsible for as multipliers and be well connected in the system. Then the NRC works on translations together with the Austrian and the Switzerland colleagues mainly in the German translation group, and we have. For the German-speaking countries, we have many connections and many things which we share in activities. So we have a close cooperation with the other German-speaking NRCs, but we also search for advice for many other national release centers. Now it works not. Oh yeah. So what is our environment? What is our framework for working? We have in the last years there have been a big bunch of new legislation activities to shape the healthcare area. Starting in 2015 with the eHealth Gesetz, and then since 2009 there has been a number of laws to shape the digitalization and support the eHealth activities. For the most important for SNOMED is the law in the middle. It's in October 2020. There's in that SNOMED will be the basic terminology for eHealth records, and as well together with LOINC. That's in this law, and all this legislation activities lead into the Sozialgesetzbuch. When you want to read what's on in Germany, you have to go to this volume, and there's regulated how the patient will be which access patients will have to the services, health services, as well as the governance and the rules. So there's a lot to regulate, but that's not extensive. But that's the things we're dealing with in respect of semantics. There's on the one the establishment of the telematics infrastructure first, the technique. Then there's what we're dealing with. What our in scope is the electronic prescription, the electronic health record, emergency data set and medication plan. That's in the law. How it is done, it will be done by medical information objects. These are building blocks which have the concept model and also the implementation plan, and they're all provided by FHIR in the simplifier. Then the governance, the different actors and roles have been established. As I was told, the SNOMED and LOINC will be basic terminologies. There's rules, the use of primary data for secondary use, and then come digitalization of different areas. The most recent are the digitalization of hospitals to ensure interoperability, and it comes more to the non-medical professions, to nursing and related health disciplines. And last but not least, we need a frame for cross-border activities. What are the major players in Germany for the technique and the projects governance and the project management is mainly the Gematik, who is responsible for the telematic infrastructure. Then we have the medical information objects, what is said, that is governed by the Kassenärztliche Bundesvereinigung, which is the physicians which are reimbursed for statutory health insurance activities. So it's business and domain driven. our role is to provide the code systems and align the semantic activities. And for cross-border activities, we have a bridgestone, which is the central post activities to connect on, which is governed by the DVK Auslandsdienst. The Gematik is advised by an interoperability council, which has been established early this year, and they advise, they do prioritization and they align with align with the different activities and interests, and all standardization activity will be stored and publicated in a central registry, which has also newly established called ENA, that it's transparent what standards are on and what some standards are to be used. So with this, I hand over to you, Frank.
Just a moment. Change devices. So thank you, Christine. My name is Frank Geier. I'm a physician at the German NRC, and I will provide you a bit with information about our activities. So let's see if this is working perfect. I want to highlight in my presentation licensing, education, of course, translation, which is a huge topic at our NRC. And I want to talk a little bit about change requests and also user support. We are at the moment in preparation for a national extension, but I don't want to touch that topic. So next slide, please. This slide shows you that we are using the MLDS, so the member and licensing distribution service provided by SNOMED International. We currently do have around about 300 licenses, and they're mostly coming from healthcare application developers. So next slide, please. Before we started our NRC, we did a stakeholder onboarding workshop. So we asked people from the area of SNOMED CT, researchers and so on, and they worked before with SNOMED CT, what do you need from us as an NRC? What shall we provide? What are your requirements? And there was a lot of requirements, of course, but one of the main were education. So that's exactly what we're doing. We're doing 2-hour basic trainings for dedicated groups, which is super important and well attended. We're doing them for healthcare professionals, project managers, data analysts, and so on. We also did this with SNOMED International, not just by ourselves. And we did a Dev Day also with SNOMED International. What is also very helpful and very well attended are these annual user forums. It's quite like an expo, but in a national way. So researchers are coming and telling us what they are doing, which projects they are doing, also what they need from us as an NRC. And it's a great opportunity to connect people to each other. So the next slide shows you a huge part of our daily business, which is translations. So in Germany, we have a very specific situation with translations. We can currently but we have to prioritize what we are translating, and it's due to legal causes. So as Christina told you, there are these MEOs, the medical information objects, done by another institute, and what they are coding, we do translate. So this is a bit of like use case based approach. It's very, sometimes very tiny ref sets, and it's very hard to find experts for that, because it's like, I don't need an expert to translate patient for me. And it's very hard to find somebody who knows everything that is in this value set. So this is our main approach. We are translating by ourselves, but we are very lucky to be in a group, the German translation group, with the NRC, Austria and Switzerland, and other researchers from that area. And we were doing a translation guideline. We are updating it regularly, and we are also doing a public feedback, because we don't yet use experts. We really want to have their opinion. So we are getting the translated content onto the community content browser by Snowmed International. And there's a feature that they can send us feedback, and we get a Jira ticket. And this Jira ticket is then discussed again in a German translation group. And we really do appreciate all their feedback, because it's very, very good. It comes from users, it comes from researchers, it comes also from private people, which is great, and from our healthcare organizations. So on the next slide, there you can see the workflow. If you want to know more about the workflow of the German translation group, I can recommend the presentation by Stefan and Stefan, which already took place, but I guess in the future, you can just click on it. We are translating by ourselves, as I said, and because we're having this legal situation, we are trying now out with certain ref sets of microbiology and nursing to work with domain expert groups. So this will be a new step in our translation process, and we're looking forward to that. Afterwards, the translations go to the German translation group, they review it, and we publish it, as I mentioned, on the community content browser. On the next slide, I just want to briefly touch on change requests, because it's a very, very delicate topic, and we had a steep learning curve. So when users are coming and want to have content in Snowmed International that they don't find, they have to approach the NRC, and yeah, it's a process. So I can recommend for the NRC really having the skills of authoring, doing the authoring courses, and for the users also to at least do the foundation course. We additionally provide users with material on our website. So we did a checklist. Users can just go through the questions saying, have you checked the daily build? Have you checked the browser? Have you checked other spellings? Have you checked synonyms? And if they always say, yes, I did not find, then we talk also to them, because it's very hard to fill out this template. And yeah, we did also a checklist. So we really explain column by column what they have to put in order that we have less work and Snowmed International has less work, and the change requests are more successful. So on the next slide, lessons learned. I guess I told you a lot about lessons learned up until now, but one of the main lessons we learned is tooling. So I would advise everybody to avoid spreadsheets, because it gets really messy really quickly. We thought about tooling and discussed and researched and asked other NRC how they are doing it. I think for a year, around about a year, something like that. We were doing also a survey. What do you use? What can you recommend? Where are the mistakes? Where are the pitfalls? And yeah, do that. We currently use just tools by Snowmed International. So the research was long, but to find it was very easy. We use the MLDS. We do use for translation and a ref setting translation tool. We do use a started using Snap to Snowmed for simple maps. I can really recommend the SNOMED community browser. We do use the CRS, and what is open and what we are looking for are tools for authoring and validation. And of course, we also want and will have a terminology server in the future. So, and I will finish with a quote. That quote is by us, actually. And it says, future technical tooling equipment should already be taken into account when acquiring the member license in order to minimize the effort for an additional tendering step. And I can really advise new NRC, but also other people just to be in touch with the community and ask other NRC how they are doing. We learned that there's a very nice and kind community. And yeah, thank you very much for listening. If you have any questions, we are happy to answer them.
Thank you, Christine and Frank. We'll now take questions. For those in the audience, please use the microphone.
We take also advice.
Okay. Well, I have a question for you. What support would you recommend SNOMED International gives to newcomers, so new member countries joining, based on your experience?
Yeah, for us, when you go to the SNOMED conference and the different activities, so it's really difficult to find information. So in the meantime, the implementation support has been in place, and that is very, very helpful. So as there's so much material, we have to keep up with 10, 15, 20 years of activities, and to jump in and to find out what's important and what is current and what should be done, what should not be done. That's really a challenge. Mm-hmm. And then it's the same with tooling. I think that everybody has to start with, has the same decisions to make, the same ideas, and a good advice, and not starting from scratch, but from the experience, have the experience from others who are since years or tens of years in the business. That's really helpful, and nobody has to start from scratch. I think it's a community here, and we can be quicker and perhaps more effective to show the pitfalls and help others.
Thank you. Mm-hmm. Okay, we have a question.
My name is Ole Våge from the Norwegian NRC. Thank you for a really nice presentation. I have a question, or not a question, but you presented something you call a kind of a national expo or a community forum. Could you talk a bit about that?
Yeah, I can elaborate a bit on that. So it's a day of presentation. We ask people actually to we are doing a tweet mostly, or a newsletter saying, hey, we're doing this annual forum. Do you want to present something? And we just give it out to the German community or to Germany. And the people from the community are coming back saying, we have this project, we would love to talk about the project, and they're doing a presentation, and then we talk about it. That's mostly it.
Yeah, and mostly they have a reason why they want to talk with us. So it's also a requirements day.
We have a question here, and then one more.
Hello, thanks for the nice presentation. I'm David Obderik from the Belgian NRC. It's great to see that you focus so much on education. We in Belgium first do all the translations and then focus on education and develop training days. So I was wondering, what were your main goals you wanted to achieve with this developer training day, your targeted audience, and which goals were achieved?
Yeah, it's my turn. Okay. I think that SNOMED is quite a difficult thing. It's not a flat list, and you learn, you have to, like a driver's license, you have to learn to do that. And that's the one thing. And everybody has a vague idea what SNOMED is, but you have to bring people on board and to to get the interested informed. And that's our way that we think that it's a new type of topic. It's our duty as the NRC to bring this topic on the agenda and bring people to work with us and get interested in things. And that's the main focus, to do education, that the people know what SNOMED is and the doctors normally say, oh, another code system, we don't like it. So it's the first reaction. So we have to convince them, and that's, I think that we took also the SNOMED value proposition paper. So it's very useful to bring people on board and to explain it. And then when you have touched them, they have to deal with this very complicated material, and that's the first change request proposal is a quite hard thing for everybody, I think.
Mikko Härkönen, NRC Finland. Thank you for presentations. I didn't get your amount of the people how many are working in your NRC. Are they full-time or part-time workers?
So what do you guess? So at the moment we are 6+. We have 6 persons, 6 full-time, and 1 is more administrative, but we have also other topics. So we cannot really say it's just the NRC. So as we having Loing on board, we had to have also to do this translation, and we have all these telematics activities. So we are the link for telematics activities. When the MIO comes, we have to we are asked for advice. We are for all telematics and implementation things. We advise for semantics, and then we have also these cross-border activities. And there are many projects on the road, and it should not be underestimated. So maybe 2 people.
I think at the end you can say 2 people. It's me doing only SNOMED, and then we have colleagues that are partly doing change requests or translations.
Yeah. And I think that the good way is also to have a network of experts. So it's to get connected and to bring people on board with domain expertise. So our goal is to move forward with, as we've learned from other groups here, that we have also to be very the cornerstone for the experts and bring people together. That's our mission. Perhaps we can get feedback from you. What's your point on this?
Okay, thank you. We have actually more questions, but we're running out of time. So very popular. Thank you very much. With this, we conclude the session. Thank you, Christine and Frank, and people online, please go back to the lobby for your next sessions. Thank you very much.